Hi everyone, this is Lori, occupational therapist, and Jana, physiotherapist here at Pillars of Wellness. Pillars of Wellness is an integrated care clinic, so you may see us doing videos with a variety of health practitioners. We wanted to cover off the topic of concussion today. We treat a lot of people with concussion, and we have a lot of different questions that they ask. The first one being, what is hurt versus harm, and how do we know when to stop pushing through the pain, or what is that limit in terms of pushing ourselves? So Jan and I wanted to cover that off. I'm going to let her explain from a physiotherapy perspective how she addresses that question with her client.
The concept of hurt versus harm is something that as a physiotherapist, I educate my clients on quite often. But depending on your injury, the degree of hurt versus harm is going to be very different. For example, if you're recovering from a frozen shoulder, your physiotherapist will often tell you that you really have to stretch your shoulder, and although it's going to be quite uncomfortable, you have to push through that pain. When you're dealing with a brain injury or a concussion, the hurt versus harm looks very different. So I often use a scale similar to this to educate my clients. So this is a symptom scale where you need to consider your overall condition. So this would be a summary of all your symptoms put together, whether you have light sensitivity, noise sensitivity, headache, dizziness, or any other symptom. So you need to evaluate yourself and combine your symptoms to create a score, where 0 would be you feel no symptoms and 10 would be that you feel absolutely terrible. So before you start your exercises, whether that be from your physiotherapist or your occupational therapist, you have to decide where you are when you start your exercise. By the time you finish your exercises, you should have gone up no more than 3 points on the symptom scale. So oftentimes where people get into trouble with this is if they start at a 0 and they're feeling great, they're often more willing to do more exercise, but then they find that they're already feeling maybe like a 7 or an 8, which means you have gone way too far because you've gone up by 7 or 8 points on the scale. So even if you start your exercises and you're feeling maybe somewhere between a 0 and a 1, you must stop your activity by the time your symptoms get to about a 4 or 5 on the scale. The other thing to consider is the increase in your symptoms that you feel should only last anywhere between 15 minutes to 1 hour after your exercise. If your symptoms last longer, you have definitely pushed too hard and might be causing more harm.
Just to add on to what Jana said, so she was obviously speaking more from a physiotherapy perspective, but when you're looking at concussion rehab in general, it applies to everything that you're doing during the day, whether it's occupational therapy treatment goals, if it's your regular daily activities, making meals, doing grocery shopping, any of those activities, you need to keep in the back of your mind where were your symptoms when you started, and making sure that you discontinue or give yourself a rest once those symptoms have elevated by a few points on that scale. The biggest thing that I tell my clients is, you know what, when you have a good day, just be happy it's a good day. Please don't push past your limits because the following day may not feel so good. So keep that in the back of your mind. It's our general principle behind hurt versus harm and pushing through pain for concussion. And hopefully that will help guide you to a more kind of wavy progression in your rehab and not escalating your symptoms and having yourself crash.